Well, hello and welcome. You're watching India Fights Back with the host Rajat Kane. In this edition of the show, we'll take up discussion on the concept of booster dose for the vaccination and how several, brands and manufacturers of vaccines are going for studies in terms of the booster dose. Is it required? Will it be required? What does future lies in terms of the vaccination and the booster shots? To discuss further on this issue, we're joined with Dr. Sunil Raina, Professor and Head Community Medicine, Dr. R.P. Government Medical College from Tanda in Himachal Pradesh. Many thanks for joining us, sir. And Dr. E. Venkata Rao, Principal Investigator, Covaxin, IMS, and member, Odisha State Advisory Committee on COVID-19. Many thanks, Dr. E. Venkata Rao, for being part of the show. Let me start with you, Dr. Rao. For the benefit of viewers, we of course, till now, we know about there are 2 vaccination doses required. And that obviously would cover large amount in terms of immunity. Now, what is the concept of booster dose?
Yeah, thank you so much.
Thanks.
First of all, let me tell the viewers that what exactly is this booster is about. The point remains is that many times people come and ask that, sir, I need to take a booster vaccine, booster dose. And this is not the routine vaccine. They have a misconception. Usually what happens is that the dose, the composition of the vaccine, whatever is being given, is whether it is the first dose or the second dose or the third dose or the booster dose, composition of the vaccine remains the same. And usually this is an inactivated organism which is being introduced inside the body. And the body fights back with production of defense mechanism in terms of antibody production or sometimes cell-mediated immunity. So that protection level which is being produced because of the vaccine is desirable or is needed up to a particular limit. If that limit is not reached with a single dose, I need to give a second dose to give it a little up. Is it sufficient? And it has been found that in case of COVID, like let it be Covaxin or Covishield, with 2 doses, the desirable level of protection has been achieved. But the question remains is, how long this protection level is likely to stay and at the same level, because we require this much protection, a minimum level, and for a minimum duration of time. If that reduces, then we need to give another booster. It's the same composition. We need to give another booster to give us the same desired level of protection as well as duration. Now, what is happening is the duration of this protection in due course of time, it's a life's process. So the antibody titer or the defense mechanism gradually wanes off. And when it reduces or comes down the desired level, then you need to give a booster.
Okay.
So this is the concept. Now, in case of COVID, till now, there is enough information or enough literature is still not available whether the immunity which is being produced by the primary vaccination, that is in case of Covishield and Covaxin, 2 doses. The same thing, primary vaccination for Sputnik V is a single dose. How long is the protection? We have not been able to find out yet. So the research is still going on, but nevertheless, there are many thoughts are there which we will discuss in due course of time.
Absolutely, absolutely. Dr. Sunil Raina joining us from Himachal. Sir, so far as I asked Dr. Rao as well, there have been 2 doses of vaccination. Now, usually is the booster dose fairly common phenomenon when it comes to vaccination for any virus infection, to say all?
First, Rajat, thanks for having me on the show.
Thanks, sir.
And this is a really important question that is being asked by you. As to whether boosters are required in all kinds of viral diseases or all kinds of vaccinations that we give across the spectrum of vaccinations that we use, whether it's in pediatric age group or in the elderly age group. Now, if you look at the greater framework of vaccinations, most of the times we don't require booster doses, but there are certain vaccines for which boosters are required. For example, tetanus is one wherein we think of boosters, or hepatitis B is another wherein we think of boosters. Now, what exactly stimulates the need for a booster in a vaccine is still not known. We still don't have the reasons with us which will tell us why do we need a booster in a particular type of disease and why don't we need a booster in another type of disease. For example, measles. We generally don't use a booster because we think that the immunity that is being offered by a single shot or the one shot that is being offered at a particular age is going to last lifelong. So what exactly immunologically stimulates the need for a booster dose is not known at this point in time, or very little amount of research is available in public domain that will tell us as to which vaccine will need a booster in a long term process. But if you look at COVID presents a different challenge. It's not like other diseases. COVID is a science in itself, which is of different nature than has been offered to us by other diseases. So in COVID, we may need a booster. Why we may need a booster is primarily because of the fact that there will be variants that will come to us in future. So we may not have the same type of virus with us for a long period of time. There will be different types of viral strains that will come up, which will dominate the scenario as far as this disease is concerned over a period of time. So we will need a vaccine which has the capability of tackling these variants. So we will need to basically tweak the vaccines in a way that are able to take care of these variants. So specifically saying that we will need a booster may not be the correct way of dealing with COVID, but saying that we will need an additional tweak in the vaccine that we are using at this point in time and will need to administer them in future may be the right way to handle this situation.
Right. I know it's still early days, both of you gentlemen, and certainly like you, a lot of research and a lot of studies are being conducted on this phenomenon of booster dose. But let me ask you one by one here. Let me ask first with you, Dr. Venkata Rao. As we have seen some cases, thankfully, fortunately, not to that extent of vaccine breakthrough or breakthrough infection as it's normally termed as, does it make a case for booster then?
Yeah. My straightforward answer would be, I can say yes.
Okay.
But along with that, I would like to tell you two more things. Now, what is happening is the people who have suffered from previous COVID infection, and to them, when we have given a vaccination, the antibody titer or the protection level has gone up excellently. On the contrary, those people who have not suffered, completely naive, and to them, when we have given the vaccination, the response mechanism has not been up to or at par with the people who have suffered. So this remains that the antibody titer is one of the correlates of protection.
Right.
Now, that is saying that, okay, it may not be sufficient. Now, in such a scenario, this is one thing. And the second point is about what I would like to. There is a broad thought that when a vaccine is a live vaccine, then a single shot is good enough. Like as Dr. Raina mentioned, is that measles is a live vaccine. Right. So in a live attenuated vaccine, you give a single shot and the lifelong or for a pretty long time, the protection is there. But on the contrary, the killed vaccines, they have a relatively lower level of protection, or the duration of protection is little lesser. But this is a broad classification. There are vaccines which are killed vaccines which have been given and can give a lifelong protection. And there are live vaccines also. These are exceptions are present. Now, if you look at this COVID vaccines, like Covaxin, if you see, it is a killed vaccine. Now, when it is a killed vaccine, it is likely that we need to give a booster.
Right.
What happened is during the Covaxin phase 2 trial, where there was a slightly larger number of participants. Over there, they had given 2 doses only at a 1 month gap. And when they realized that, okay, there could be a need for a booster on the 6th month, that is 0, 1, and 6, 5 months following the second dose, they started giving the booster dose. And the results are still awaited. In the month of August, end of August or September, the results are likely to come. But in other countries, they have already done these experiments and they have come up that, yes, certain boosters are required. But one negative point I would like to tell you that what is happening is usually we measure the antibody titer, which is easy to measure.
Right.
But the protection level is not necessarily being offered by the antibody titer. There is something else called cell-mediated immunity also.
Okay.
But now, having explained all these three concepts, now let me answer to your question is that if there are breakthrough infections, should you require a booster? Answer could be dual. You may be yes or it may be no. Because we need literature. Because all those breakthrough infections which have been, reported, what is their antibody titer, or what is their cell-mediated immunity, the measurement of cell-mediated immunity, and that kind of literature is still lacking because COVID is a new virus. And the research is going on. It's not too far off. Maybe a month or couple of months, we would be ready with that answer.
Right. Dr. Raina, your take on say, booster requirement or case for booster, especially in the wake of breakthrough infection. I know it's small in numbers still, but does it make a case a booster?
Look, Rajat, we need to understand the vaccines that are available with us. How do they work? Now, if you look at both the vaccines, the major vaccines that we have, both Covaxin as well as Covishield. Now, both these vaccines at this point in time are being seen as vaccines which don't offer a sterilizing immunity. By that, what I mean is that none of these vaccines is able to tell us with 100% certainty that you will not pick up an infection of a natural type, even if you are vaccinated. So, if you have received 2 doses of vaccines, you may again be infected with a natural infection.
Right.
So breakthrough infection is something which has not been ruled out by both these vaccines because they don't offer you sterilizing immunity.
Certainly.
The goalpost for both these vaccines at the point of establishment of these vaccines as a framework was that we wanted to prevent severity of disease. That was the goalpost that we had fixed at that point in time. Over a period of time, what happened was that we realized that these both vaccines, as well as other vaccines that are available in the market world over, were able to provide some protection against transmission itself. This was not the primary goalpost. That was something which we realized over a period of time. So this concept of breakthrough infection came. The concept of breakthrough infection was not an original concept with COVID vaccine. It came up later on when we realized that these vaccines were able to prevent some degree of transmission of infection from one person to another.
Right.
Now, if you look at the data that is available with us around the world, it says that if you have a new variant coming up, the Delta was the latest that came up across the world, and Delta Plus is something that is being thought of. Lambda is another virus strain that is being thought of in other parts of the world. So what it did say? It says that when a new variant comes, like the Delta came, the single dosage with one of these vaccines was only able to provide an efficacious transmission immunity of 33%, meaning thereby that the transmission will be reduced up to 33%. So if you are going to give second dose, the transmission efficacy will be up to 66% or 60%. So you are still leaving a large number of people who can have infection. So truly labeling them as breakthrough infection will not be correct because we are anticipating at the onset itself that the infections will be there. What is a worry to us is whether these breakthrough infections are of serious nature or are going to kill people. That's something that has been in public domain for a long period of time with both these vaccines which are in operation in India. Now, as I talked about earlier as well, why do we need a booster? I am not very happy with the word booster as far as COVID is concerned. I am equating the vaccination process in COVID with the way we do in flu, for example. So every year what we do with flu is that every year we see the most dominant or the most popular type of strain that is available. We cover vaccines around that strain and administer those strains to people. We don't call them boosters as such. We say that we are giving a new form of vaccine every year suited to the type of virus that is available around us. So this is something that may happen with COVID also, because of the fact that there will be mutations, because of the fact that the strains may change. So you will have to tweak your vaccines, which may not necessarily be reflective of the primary vaccine that was developed. So you may not always have the original vaccine that was developed maybe a year back. In 2 years from now, when we are administering for COVID, the newer vaccines may have entirely changed, or it may have retained some part of the original component. Now, the research that has gone across the world, for example, that has been done over the original vaccines, and then they say that if you retain some part of the original vaccine, make a tweak with the other parts of the original vaccine, they're effective in controlling for variants. So this may be the reality as of now, but this reality may not stay like that for all period of time.
Right.
So boosters may not exactly be the correct word of defining it. We may say that we will need to tweak vaccines here and there to take care of the variants that may come up in future time with us.
That's really important, Dr. Raina. The phenomenon itself that there would be mutations of a virus as it is common, and certainly, there would be new strains, and of course, we perhaps may require a different sort of vaccine over the years. If that could not, and not necessarily a parent vaccine that we are administering today. So in that case, will there be an interest group who, of course, need to be monitored with the new vaccination, or at least with a new strain, or perhaps, the parent vaccination, or just 2 doses are enough for them? Dr. Raina, first you, sir.
Look, the best way of dealing with this pandemic is to share scientific data that is available around the world at this point in time. What has happened with this vaccination is you have vaccinations being available to some people in plenty and vaccines being not available to others, even in small numbers. So there are 2 groups at this point in time. One group has plenty of vaccines, but hesitancy is huge. Another group has no vaccines and hesitancy is not there. So one, scientific data has to be shared between each group, both the groups in fact. Because ultimately what will happen is over a period of time, you will have the global openings there. People will go from one place to another. But we will also need to realize the type of strain that is being brought by the people from one place to another. So if you are opening up the world, the strain that I will be getting from India to maybe Europe, it has to be monitored. And once we have that monitoring process in place, we will be able to generate new evidence as far as vaccine creation is concerned or vaccine development is concerned. So open data is one part of it. Second part of it is that, as you answered, is whether we will need to go beyond this 2-dose regime. At this point in time, I earnestly see a need for going beyond this 2-dose regime. There is a dire need for scientifically to think of going beyond this 2-dose regime. Not because of the fact that we will be boosting the impact of the first dose, but because of the fact that, as I said, we will need to tweak the vaccines, which is suited more to deal with the current situation that will be prevailing at that point in time. But sharing of data will be the key. Then and then only we will need to know what type of strains are circulating around the world, what type of vaccines will need to be developed. You need to see it this way. Not every country in the world will be able to develop a vaccine. There are very few countries in this world at this point in time who have their own vaccines. But the data sharing will help the countries which are developing vaccines to develop vaccines which have global impact. So, for example, I have to develop a vaccine for Africa at this point in time. But I will have to have data. Which type of viral strain is circulating around Africa in this point in time, or may come up in another 6 months of time. So this data sharing will be key if we need to develop global vaccines, not vaccines which are impacting certain populations. Europe, America, India, for example. We will need vaccines which have a global impact, and for that, data on the viral strains which are circulating is needed.
Right. Dr. E. Venkata Rao, as we close the show, sir, your last take. Are we looking therefore towards scenario where we have possibly I'm saying in terms more of a hypothesis, a different vaccine over two or 3 years down the line than what we currently have, like the vaccine regime that we have today would be changed, or say would be modulated into something else?
Yeah, definitely. As Sunil mentioned, it's exactly that. The new strains, if they are coming, we need to tweak the existing strains like influenza virus vaccine. What we have, every year we have a new intervention. But one more point I would like to add it here is about this breakthrough infections. What we are talking about is like when we are taking the vaccine, there are 2 types of antibodies which are required. One is locally active, other one is systemic. IgG antibody is effective in the systemic production, but there's new vaccines like the nasal vaccine, in case they come, that would also be useful in interrupting the chain of transmission. And one last word I would like to say that when the country is still facing, this is a public health perspective, that the first dose of the vaccine people haven't received yet. Second dose of the vaccine, there are a good number of people. In such a scenario, how well can we roll out the booster? Because it is a humongous challenge for the health system. Yeah.
Right, absolutely. You're absolutely right, Dr. E. Venkata Rao, in terms of the vaccine availability. That is something that administrations and the governments across the states and the center needs to do a little bit more so as to have vaccination to the last person. Also, from our side, from the side of public, they have to overcome the vaccine hesitation. Now, for that, you need to only hear the science. You need to only refer to scientific connotations of the vaccine. Do not listen to any hearsay. There is a lot of things still on the social media and other forms of media and other forms of communication about vaccine, which is complete misinformation. So please keep listening to experts and keep please listening to only the scientific experts. That's the only way we can defeat the pandemic. Well, that's it in this edition of the show. Many thanks, gentlemen, Dr. Sunil Raina for joining us and Dr. E. Venkata Rao for being part of the show. Many thanks, and many thanks to our viewers for watching this edition of India Fights Back. Thank you. Goodbye.